Hi, good morning, everybody, and thank you very much for joining our webcast event hosted by the Canadian Nuclear Isotope Council. For those of you that don't know me, my name is James Skonyak, and I'm the chair of the Canadian Nuclear Isotope Council. And today we're getting together to talk about what I think is a really important topic when it comes to ensuring we have a secure, reliable supply of medical isotopes. And today we have a number of guests, which we look forward to a panel discussion with. Our first guest that will be joining us later is Andrea Armstrong, who's a research scientist with nuclear operations and facilities and a professor of chemistry and chemical biology at McMaster University, and Michael Flagg, who is the director of isotope supply for BWXT. We look forward to a discussion amongst this important community and these leaders in this sector on this critical issue. You know, one of the things, if we take a step back and we reflect on the kind of conversations we would be having, whether it's in the area of isotopes or supply chain, back in the 2019 timeframe, you know, there wasn't a tremendous amount of focus on key issues such as supply chain disruptions and supply chain reliability. And obviously, COVID-19 changed a lot of that. COVID-19 reminded us of the risks associated with just-in-time supply chains and the challenges that we encountered through the pandemic, whether it was normal consumables that consumers needed, whether it was personal protective equipment. There's a whole series of things in our everyday lives that we became very comfortable having ready and consistent access to. COVID-19 exposed some real weaknesses, and we had to calibrate, we had to readjust, and ensure that we retooled to not only cover those gaps, but position ourselves for a stronger position for future events or to recognize how our world has changed. And frankly, even though many of us have gone back to a new normal, COVID-19 is still declared a global pandemic. While many of us have gone back to a new normal, the supply challenges and changes that COVID introduced to supply chains all over the world are still with us today. We still see very significant backlogs, and it's frankly going to be many, many years before we're back to where we were pre-pandemic. I now fast forward to 2022, which has also been, I would argue, an unprecedented year from the perspective of disrupted supply chains. If we look at the Russian invasion of Ukraine and the associated actions by the world community in response to that aggressive action of Russia on another independent country in the case of Ukraine, that has also introduced a series of other very significant supply chain considerations, whether that's security of supply and not relying on certain regimes in certain countries for a disproportionate amount of role in a particular supply chain, but also recognizing that with global and geopolitical events, there can also be imposed disruptions to supply chains in the case of sanctions or government intervention meant to specifically disrupt a supply chain and penalize a country, as has been the case with Russia, quite appropriately so. So putting those two concepts together and putting what we've experienced with supply chains, now we look at the topic of medical isotopes. And that's really what we want to discuss and engage on today, which is recognizing these geopolitical challenges that we've experienced, but recognizing they can continue to persist through different causes, through different events in the years and decades to come. What is it that we need to do as a Canadian isotope community to ensure that we do build supply chain resiliency? And that's just not about ensuring that our businesses can continue to operate and manage day-to-day operations, although that's a really important part of it. Fundamentally, the role that we play in ensuring we have a stable supply of medical isotopes, we can never forget that at the end of that chain, at the end of that supply chain, is a patient who is in desperate need of either an isotope to diagnose potentially that they have cancer, to treat cancer, or in the case of theranostics, to do both. So there's a very important responsibility in front of us that as we see our medical professionals around the world make significant strides in the diagnosis and treatment of cancer, it sits on us to ensure that we are securing a very stable, reliable supply chain when it comes to medical isotopes. And so I think today's conversation is really important. A few key things that I want to start today's conversation off with, just to really re-anchor ourselves in terms of Canada's very unique role. For nearly half a century, Canada has been a world leader in the development, the supply, the processing, and the use of medical isotopes. Whether those are medical isotopes, as I noted earlier, to treat to diagnose or treat cancer, or whether they're whether they're isotopes for industrial purposes, or isotopes to support sterilization, which is absolutely critical in our healthcare community. Canada has been a world leader, and as Canadians, while we may only be a country of 35, 36 million people in a growing world of coming up on 8 billion people, the world looks to Canada for leadership when it comes to medical isotopes. And that's really because of two things. We have some assets as a country, whether it's our post-secondary institutions, whether it's our healthcare institutions, or whether it's our ability to produce and process isotopes, whether those are isotopes that are produced in power reactors. I'm connected from the Bruce B nuclear generating station at Bruce Power. It's one of the world's largest suppliers of medical isotopes. We have power reactors that can carry out that function, but we also have a cyclotron community that is equally and critically important to that as well. And if we put all of those assets together and overlay that, most importantly, the human resource and the human expertise that we provide in this field, it's very clear that Canada is a leader. But it's not just about being a leader. It's about recognizing that the position Canada has is very unique, and it is not easily replicated in other jurisdictions. So not only with that comes an important opportunity, but with that also comes an important responsibility to ensure that we are building a robust Canadian nuclear isotope supply chain that the world can count on. And I always like to say that's from tip to tail. It's every element and all components in between. I think the one area with COVID-19 in particular that most resonates with me is also just about how when supply chains are disrupted, we look at the very significant effects that has on our healthcare professionals and on patients. In the case of COVID-19, we knew there was a significant shortage of personal protective equipment. But fundamentally, what did that mean? That meant that we had healthcare professionals on the front line that were not protected in doing their jobs as effectively as they needed to. It meant that patients were at further risks. And the same is the case with medical isotopes. The inability to have a robust supply chain in the area of medical isotopes, what it means is that we're letting our healthcare professionals down. It means we're letting patients down. And that's a global challenge. But a global challenge can only be tackled and advanced through leadership. And I think Canadian leadership is more important than ever. The other area I think that is important that we should recognize as part of that global leadership is that for many, many years, Russia has been a jurisdiction that has also been a leader similar to Canada in many ways in the supply of medical isotopes. And as we look at the various geopolitical intentions and many of the aggressions from the Russian regime and the associated global response to that, and in particular how we as Canadians are standing united against that aggression and in support of Ukraine, we need to recognize that over the long term, we cannot, as a world, rely on Russia for medical isotopes, for the supply chain. We need to build a supply chain that is robust without reliance on Russia. And I think when I look at the capabilities that we have here in Canada, and I look at those assets I talked about, whether they're physical assets, whether it's technological innovation, or most importantly, the people that drive this sector, we have all of the right ingredients here in Canada to provide the world that certainty. So not only is there a leadership opportunity, but there's a leadership imperative for us to step up and for us to be there. The one other geopolitical component that I think is important to also talk about is how the world is changing. We continue to see growth in many Asian countries and countries around the world. And with that population growth and economic growth comes a growing middle class. And that should be something we should all welcome and encourage. But with a growing middle class means that as we raise the standard of living of a growing number of people around the world, it's important that growing middle class and more people having access to many of the things that we as Canadians have come to enjoy over many, many years when it comes to quality healthcare. We need to recognize there's going to be large segments of the world population that is now going to have access to that high quality healthcare. And that's a good thing. But with that will come an astronomical growth in all of the things that we're talking about. There'll be an astronomical growth for sterilization of medical equipment. There'll be an astronomical growth in the need for isotopes, and I'm sure Mike's going to talk about this in our roundtable, such as molybdenum-99 for diagnostic. There's going to be an astronomical growth for theranostics, such as lutetium-177. There's going to be astronomical growth for a range of isotopes, whether it's the iodines that are produced at McMaster University or the actiniums that we're looking at continuing to advance in our cyclotrons. The growth in this sector is going to be significant. And what we can't have happen, we're all citizens of this world together, what we can't have happen is a scenario where the ability of patients to access these treatments is limited by supply of isotopes. There may be other economic or governmental policy factors that will be challenges, and it's certainly going to be up to those jurisdictions to break those barriers down. But we can't have the supply of isotopes as one of those barriers, because we know we have the infrastructure, we have the tools, and we have the capability to ensure there is an adequate supply of medical isotopes. And so not only would I ask us to think about this discussion today from the perspective of the opportunity for Canada and what we can do collectively to strengthen the supply chain, but I think we need to think about this supply chain in a fundamentally different way than we already have. There's going to be countries that have demand for isotopes that have never had demand before. So not only are we in a case of talking about strengthening the supply chain, it's also about innovating the supply chain. What do we need to do differently? What do we need to do to create redundancy? And as I mentioned before, the world is counting on Canada and our unique position to provide that leadership. So one of the final things I do want to talk about before I introduce more formally our panelists and start our panelist discussion is I want to talk a little bit about some of the work that's underway by the Canadian Nuclear Isotope Council. We're absolutely honored to have a council that in just a very short period of time has grown exponentially with representation throughout the entire country. We are over 70 members in the Canadian Nuclear Isotope Council, and we have a number of members that are making outstanding financial contributions to the council. Whether those are financial contributions or in-kind contributions, they're contributing to the sustainability and the growth of the Canadian Nuclear Isotope Council. And we've recently formed an executive committee of those members to start looking at what does the next 2, 5, 10 years look like at the Canadian Nuclear Isotope Council, because we recognize there's a strategic need for this council, not only here in terms of influencing policy and working together to bring this sector together here in Canada, but ensuring that role, that Canadian leadership role that we will continue to play, is well positioned to deal with some of the very broad and critical geopolitical issues and global healthcare considerations. Before I introduce our two guests, there's two individuals I do want to recognize. There's a tremendous amount of work that is underway on the part of the Canadian Nuclear Isotope Council, and that work would not be possible without the work of our Executive Director, Andrew Teal, and Melody Greaves. They work exceptionally hard. It's a very lean, agile organization. They are the sometimes we use a term jack of all trades, master of none. They are the jack of all trades and the master of all, is how I'll change that saying. They do absolutely outstanding work. And I think how the Canadian Nuclear Isotope Council has been successful has been with that level of agility. So we appreciate your support of the Canadian Nuclear Isotope Council, your participation in these events, but recognize there's going to be more that we have to do as a council in the months and the years ahead to really take this tremendous opportunity we have and turn it into action. And that's really what today's conversation is all about. So what I'd now like to do is introduce our two panelists. We really appreciate them taking time out of their busy schedules for them to join us. And our first panelist, as I mentioned earlier, is Andrea Armstrong. She's a research scientist with nuclear operations and facilities at McMaster University and a professor of chemistry and chemical biology. So Andrea is the kind of person that when you were in your master's program at university, you wanted to sit beside her and copy her answers because she was probably right. She's led McMaster University's radioisotope research and development program since 2009. And her research is really focused around reactor-based isotope production. And that includes the discovery, the translation, and the commercialization of novel medical isotopes. She has over 15 years of experience in both production, radiochemical separations, and device development, and also early stage radiopharmaceutical design. She's also serves as the co-chair of the Canadian Nuclear Society Science and Technology Radioisotopes Division and a member of the Canadian Nuclear Isotope Council's Policy Committee. And she has a PhD from the University of Calgary. So thank you very much for joining us, Andrea. We also have Mike Flagg, who's the Director of Supply for BWXT. As you know, BWXT is doing just amazing work in this space, both here in Canada, but also around the world. And he holds a Bachelor of Science in Nuclear Engineering from Missouri University of Science and Technology. And he spent over a decade at the University of Missouri Research Reactor, starting off in engineering and program management and eventually serving as Associate Director of Special Projects and Business Development. Other roles he has served include project management for pharmaceutical testing and also as director of clinical operations for a clinical research organization. As noted, he works as the director of strategic supply for BWXT Medical. And we look forward to hearing the great work that BWXT is doing and Mike's broad industry and sector experience as we bring to this discussion. So thank you very much, Andrea and Mike, for joining us today.
Happy to be here.
So why don't I start with a question to kick things off? Some people were kind enough to send questions in advance. We'll do maybe a couple of questions that had been submitted in advance, and then open it up to members of the council. We have a really good turnout here today to submit your questions. But the first question is, maybe taking a step back, and if it's okay, Andrea, maybe we'll start with you, and maybe you can just talk about from your perspective at McMaster University, just really how has your organization been impacted by some of these supply chains disruptions? How have you coped, and what does it mean for the future?
Sure. Thanks, James. So McMaster we're a major global supplier of medical isotopes. So we're the home of Canada's only major nuclear research reactor. We're the world's largest supplier of iodine-125, which is used to treat about 70,000 cancer patients every year all around the world. And we're one of the world's top 3 producers of a newer isotope called holmium-166 that's used to treat liver cancer and liver metastases. So in the last couple of years, like everyone else, we've experienced a lot of supply chain disruptions, first around COVID. As some of our members may know, a lot of our medical isotopes actually travel around the world on passenger flights. So of course, when there's a massive disruption in air transit, that makes a big impact on us because our isotopes are not able to get to where they're going on schedule. With the recent political events in Russia and Ukraine, we've experienced disruptions again. We're still having challenges with any flights that would be going through Russian airspace to reach many of our Asian customers. And so we're looking at alternative shipping routes. These are by and large resulting in longer shipping times. So we're getting more losses of our radioisotopes through radioactive decay in transit. From a research standpoint, as a person who deals with a lot of external users who want access to facilities and isotopes from MAC, I can say that we've been seeing requests for a wider range of radioisotopes than we usually get, and we're attributing this to lack of availability of materials from Russia. So some of these are medical isotopes. A lot of them are calibrants, so standards and reagents that are used to calibrate medical equipment in hospitals. So when a physician goes to use a particular scanner or to measure out a patient dose of a radioisotope, they need to know that that piece of equipment they're using is working accurately. And many of those types of radioisotopes, some of them do come from Russia. Similarly, isotopes used for nuclear gauging in the construction industry, infrastructure maintenance, and so on, as well as environmental monitoring. So a lot of these are things that come from nuclear fuel reprocessing, which is not something that Canada currently does. So we would typically import those from Russia right now. From a research and development standpoint, I run the university's radioisotope R&D program, and we've been having trouble getting access to stable isotopes that we use for research purposes. So when we make a medical isotope, we usually start off with a stable enriched isotope, and that's our raw material that we need to use to make our radioactive isotope that has useful properties. And Russia is probably the world's biggest producer of those enriched stable isotopes, and we've been having challenges getting access to those. So it's a critical piece for Canada and for innovation in Canada, because as a research facility, as the only major research reactor in Canada, we play a critical role in enabling early stage research in Canada. So we make sure that scientists at Canadian universities have early access to sort of next generation medical isotopes that are not yet commercially available, not yet being produced at scale. Because before you start mass producing a drug or a drug product, you need to first show in your lab that it's got the expected behavior and that it really is an effective treatment for whichever type of cancer you're studying. So we play an important role in making sure that scientists have access to these so that they can help to develop new drugs and so on. So those have been the biggest impacts we've felt. Regarding shipping, we're looking at different shipping routes whenever possible. And around research and development, we're looking at using different methods that don't necessarily rely on stable isotopes for the very early stage of our research. So these are processes that are generally a little bit less efficient, less effective, and we're really just waiting for the supply chain to open back up.
That's great, Andrea. And I think, no doubt it's, you sometimes read about these in the newspaper from a very geopolitical perspective, but, right here in Ontario through your operations, you're seeing the impact of that, firsthand. And so those are really helpful insights. So maybe I'll move over to you, Mike. So from a BWXT perspective, obviously you have operations from looking at Canada in both Ottawa and Vancouver. What are you seeing?
A lot of the same things Andrea mentioned, specifically with the enriched stable isotopes. I know there's been a lot of discussion in the industry on that, and that affects not just routine production, but also R&D work we might want to do. Again, as Andrea mentioned, starting with less efficient processes is one way to get there. But I would also say this is the kind of spur, perhaps, that's many of us have been wanting in this, not wanting the downside of the supply interruptions, but to see especially Canada get serious about enrichment again. There are a handful of firms that are active in moving into the stable enrichment isotope space for a number of key starting materials. This is very exciting. It's very encouraging. And again, while it's a tough way to get there, I believe in the long term, it's a far healthier ecosystem for all of us to be working in.
No, it's a great perspective, and maybe I'll go back to you, Andrea, and really digging into this more from a perspective of what we're seeing in Russia. How would you, as somebody who's been in this field for a long time, especially with what we see on the reactor side with isotopes, how would you characterize Russia's position in this global sector, and where do you see the greatest opportunities for Canada to sort of, lean in as part of this global situation and ensure that we're not reliant on Russian isotopes?
Sure, that's a great question. So Russia obviously is a major tier one nuclear nation, the same as Canada is, and they have full domestic supply, everything from enrichment of stable isotopes through design of new medical devices, new radiopharmaceuticals, et cetera, et cetera. So they have full scope spectrum capabilities in Russia. It's important to understand how complex the global supply chain is for medical isotopes, for radiopharmaceuticals, for products that contain these. So the things that the clinicians actually use in hospitals, they're not simple to make. There's often several steps involved with these. So you start off with your stable enriched isotope, and then it goes through several steps after that. So you might have a hospital, say in Ottawa or in Victoria, that's using a source of, let's pick iridium-192 as an example. So that's a standard isotope that's used to treat cervical cancer, prostate cancer, et cetera, et cetera. And that Canadian hospital might have purchased that source from, say, the US. The US might be manufacturing these sources of iridium-192. But the person who's manufacturing the sources in the US, in our example, probably didn't make that radioisotope themselves. They probably purchased that radioactive material, perhaps from a research reactor in South Africa or in Belgium. The South Africans and the Belgians, in turn, might have sourced that stable enriched target from Russia. So although on the surface it looks like your Canadian hospital is shopping locally or shopping just across the border in the US, in fact, by the time the radioactive iridium gets into the Canadian hospital, it's traveled through several different countries and several different processing and production facilities. So as Mike was saying, the really key step that Russia has that Canada doesn't currently have is that enrichment technology, the ability to enrich those stable isotopes so that when you take the material and put it in your nuclear reactor, you're only generating the radioisotope that you want, not a whole bunch of unwanted radioactive byproducts that you then have to deal with separating and processing and disposing of as radioactive waste. So that's the real key piece that Russia has that Canada doesn't currently have. Russia does, of course, distribute medical isotopes and products throughout Russia. Of course, is a large country. They have a lot of people, and they do supply to within their sphere of influence. To my knowledge, I don't think there are any radioisotopes produced in Russia that are used directly in Canadian clinics. I may be wrong, but I don't think there are not the radioactive forms. But we are heavily reliant on the global supply chain when we look at sourcing enriched isotopes, either for routine production or for research and development.
Well, that's really helpful. And Mike, from your perspective, to me, when you see these types of, let's call them geopolitical issues, integrated supply chain issues, if you take a step back from a Canadian point of view, whether it's policymakers, whether it's regulators, what do you think we need to do here in Canada from either a policy or regulatory perspective to be able to adapt to this changing, both the changing circumstance, but also the opportunity that it presents?
Sure. And I think doing what we've done in the last 9 months, frankly, the communication about the criticality of radioisotope supply, and even this sort of esoteric niche that is stable enriched isotopes. All of us on this call, we know what's going on with that, but that's not a typical thing that a policymaker is going to have front of mind. So the great communication we saw as events unfolded in Q1 on the Canadian side, as the impact of the various sanctions regimes as they progressed, that communication is key. And that is a benefit, frankly, of a country with a smaller population and a highly functional government and regulatory structure. This kind of feedback between experts in the industry and the policymakers, and trying to balance the very real understanding that, look, we are actively moving to disrupt the supply chain on purpose for reasons. And then just making sure that we all understand the balance between patient impact and frankly, an incentive structure to ensure that local ecosystems grow stronger so that we don't have to be dependent upon a structure that got put into place in the 90s, especially for reasons. Then those reasons no longer obtain. There were reasons to utilize a lot of those Russian assets and the Russian talent after the collapse of the Soviet Union. That the world's evolved, and Canada is rapidly evolving with it. And I would just say kudos to how it was handled so far. But that communication, in my opinion, is the key factor.
No, absolutely. And I think one of the other things, that I would add here is I think Canada, in terms of our independent quasi-judicial regulator in the Canadian Nuclear Safety Commission, is a real, let me call it an advantage, because having an independent regulator that is making decisions based on fact and science and safety, to me, that clarity of a regulatory environment is absolutely critical. And that with that certainty, we know what the bar is, and we can meet and exceed that bar. I'm going to now move to audience questions. So if people have any questions, please put them in the box, and I would like to make sure that we cover those off. So please submit those, and I'll make sure we cover as many of them as we can. Maybe I'll go back to you, Andrea, and really just curious about your experience in terms of there is a real focus here in Canada. Obviously speaking here at Bruce Power, but at Darlington, the ongoing work that is already done at Pickering, and obviously your facility in Hamilton as well. In terms of reactor-based isotope production, what do you see as the real growth isotopes? What should be what isotopes should we be thinking about in terms of reactor-based isotope production, and why, and where are the areas we need to speed up and put our attention to?
Oh, now that's a challenging question. There's so many isotopes out there that have so much capability. Personally, as a scientist, from a scientific standpoint, I'm so impressed with the work that's going on at BWXT around extracting Tech-99M from natural moly. I mean, that can be a game changer, right? That gets you away from reprocessing enriched uranium to be extracting out moly-99, which, as most of us know, is the precursor to technetium-99M. There's about 1.2 million people in Canada every year who get diagnosed using technetium-99M. So I'm a chemist at heart, and I'm a scientist at heart, so I'm very excited about seeing that. But there's so much innovation that's coming out all across Canada, whether that's new radioembolic therapies that are coming out of Halifax, or whether that's TheraSphere, which is homegrown, which is dispensed right now in Ottawa, or the Querum spheres that we make here at McMaster University that are starting clinical trials in Canada coming up next year. So Canada, it's so important for us to be involved in the innovation chain on these things. So Querum spheres is a product that has a very short half-life. Right now, it's only available in Europe. But because we've done the research and development here to be able to produce that here in Canada, Canada is going to be included in a global clinical trial. Okay, typically, when you have a technology developer and they want to launch a new drug product, they mostly will stick to the US because it's the bigger market. And if you launch a clinical trial in more than one country, you have more than one person regulating, looking at data, and it creates a whole bunch of extra work. There's extra cost, there's extra paperwork. So typically a multinational company, if they want to have a new product entering the market, will go to the US only. And that leaves Canadian patients with delayed access to new technologies. So because Canada and MAC have been involved in developing capacity to make this new product, Canada is going to be involved in the clinical trials of this new liver cancer therapy. And we're going to have patients treated in Canada. Actually, the first patients outside of Europe will be right here in Canada. So participating in innovation is important. And there's so many isotopes. I don't want to bore everyone. I could talk for hours about isotopes, but I won't. I'll leave it right there. I see we have some questions coming in from the audience. So I'll leave it to the audience to direct things.
That's great. And just before we go to the next audience question, Mike, from your perspective, anything you want to add to what Andrea said on isotopes to focus on, whether they're diagnostic, therapeutic?
Right. So, well, first off, again, Canadian leadership, it's just amazing to watch. So if you look to Bruce Power and the mechanism to do irradiations to create lutetium-177, a key therapeutic. And therapeutics have been driving this recent big boom in investment and growth in our market. This initial boom has been built on the back of the existing structure, obviously, with moly and moly-tech generators and other isotopes. But lutetium really uncorked a lot of amazing ideas and capital investment. So to have a platform that you can use a power reactor to do something other than cobalt, it's just amazing. We obviously have a similar partnership with OPG at the Darlington facility to access the reactor in a different way, in a different place. But the same idea to have that platform to do interesting things with these new and up and coming isotopes. But this influx of capital has just been so fun to watch. Lutetium has obviously had a lot of applications, but we're seeing actinium-225, which has been talked about for decades. Well, now you're seeing Canada, out of the Triumph facility and a partnership we have over there, leading the way in commercial supply of actinium-225. It's to see other things like even copper-67. They're out in Saskatoon. The folks at the Canadian Light Source, they are working with partners to produce copper-67 hope to go to commercial. There's so many interesting isotopes now getting the attention and air and the oxygen in the room finally to really explore their potential. And like Andrea, we could talk all day about the charter nuclides and all the really interesting things we could pull out of them, but to see the intense activity around not just the stable and well understood isotopes, but these new cutting edge ones is just fun to watch.
No, that's great, and maybe we will do an all day webcast. I'd be certainly up for that. It's a great conversation. So we'll move to a question, and I think this is a really good one because I can't remember what Canadian province it was. I think it was in Eastern Canada, if I'm not mistaken, Nova Scotia. There was an article. You guys can correct me if I'm wrong, but there was some media this week about Moly 99 and iodine 131 causing some shortages. Do you guys have any background? Maybe I'll go to you, Andrea, to start. Any context on that disruption? Was it a reactor issue? Was it a processing issue? Anything you can share with the group on that?
I can share the information I have. So we're all aware of the big supply chain crunch around Moly 99 back in 2009, 2010, which we know was caused by the fact that you really only had 3 major producers of this isotope worldwide. And then, of course, when one is on a planned maintenance outage and a second one experiences an unplanned outage, you end up with a supply chain crunch. The last 10 years, I would say the global community has done a really great job of diversifying that supply chain. So we now have about 8 different reactors that are contributing to the global supply of Moly 99. And that's not even counting looking at technology diversification. So there's lots of ways you can deal with the Moly challenge. One of them is by technology solutions like what BWXT is looking at doing, where instead of reprocessing uranium, you're making the Moly directly in a power reactor. Right now, the global supply chain is still reliant on Moly 99 that comes primarily from nuclear fission. And there's a limit to how many processing facilities worldwide are going to be able to do that type of work because of the security concerns around access to material and transportation of material. So the number of processing facilities worldwide remains limited, and the number of reactors that are going to be able to contribute to that supply chain is somewhat limited. There are about 8 of them now, up from 3 10 years ago. So this is a huge improvement. My understanding is that what's going on right now is the Belgian reactor, which was scheduled to come back online at the end of October, is experiencing a maintenance issue that's going to require some repairs. It's really astonishing. The research reactors are all competitors, right? They're all competing. They're all selling the same product, but they do a phenomenal job of coordinating their outages to make sure that there aren't supply chain crunches, 95% of the time. So the Belgian reactor was scheduled to be down for maintenance in October and then come back online. And because of that, 2 of the other major producers have scheduled their maintenance outages for November, expecting that the Belgians would be back up and able to take on most of the irradiation capacity. So the issue right now is that one reactor in Europe hasn't come back online. So a couple of the other reactors are staying online after they had planned to do so to try to make up some of the capacity. That's my understanding. Mike, maybe you have better information than I do.
No, you're spot on, Andrea. This was a single reactor that does need some additional maintenance. And as you pointed out, we are in such a different world now in terms of the suppliers that while I think there could be some hiccups, it's not going to be anything like we remember from 10, 15 years ago. So definitely something to pay attention to. The Belgian reactor BR2 is a fabulous machine. They are a great team there. So any challenges at such a good place, all of us take notice. But as Andrea pointed out, there is coordination on outages, not on the business side, but on the outages, so that they can ensure to be able to make, the patients need to be served, and they make sure they coordinate their maintenance appropriately.
And a minor point that I think people often don't pick up on is when you make Moly 99 from fission, you notice that question referred to Moly 99 and I-131. So when you separate out Moly 99, you kind of get I-131 as a gift with purchase. Okay, both the isotopes are present in the same isotope soup. You separate out the moly, and the iodine kind of pops out too. So this is, to me, one of the more fascinating questions. As we start looking at technology solutions to Moly 99, and we start looking at different ways of making Moly 99 that don't involve this uranium reprocessing, where's our I-131 going to come from? You may start diversifying the Moly 99 supply chain, but someone's got to keep an eye on the I-131 supply chain. If you want to try to look at phasing out uranium reprocessing, where's the I-131 going to come from? And you can make it deliberately in a research reactor. We've done that at MAC. You take tellurium oxides, you put them in the nuclear reactor, or you heat things up to 800 degrees, and whammo, you've got your I-131. But it is a less efficient production route than what you're currently doing when you're reprocessing uranium and separating out the iodine and the Moly 99.
Okay, no, that's really helpful. And actually, maybe while we're with you, Andrea, we have a question. Can you just walk us through thinking about your facility there at McMaster? What are the what are the isotopes that you're currently manufacturing?
We make a couple of dozen different radioisotopes and radiotracers.
What would the big hitters be?
Iodine-125 is for sure our biggest hitter. We're 60% of the global supply of that isotope. So Uzbekistan is probably another 30%, and the remaining 10% is Russia. So I-125 is our biggest one, followed probably on a commercial scale by Querum Series, which is holmium-166. But we also produce isotopes for nuclear forensics. We produce isotopes for people who are studying ecology. So what happens when you've got uranium mining runoff out in the countryside? It's enriched in selenium. Where does that selenium go? What is it doing in the environment? Does it get bioaccumulated going up the food chain? So these are all types of questions that you can answer using radioisotopes and radioactive tracers. And of course, we supply about 5 or 6 different therapeutic medical isotopes to researchers both on our campus and at universities across Canada. So people who are developing new radiopharmaceuticals, better brachytherapy sources, and so on and so forth.
Okay, no, that's really helpful. And Mike, we'll send the next question over to you, because I know you guys have a cyclotron in partnership with Triumph in Vancouver, British Columbia. Is there a future for cyclotron-produced technetium-99?
Great question. We do run 3 small cyclotrons at the Triumph site, in addition to the very large cyclotron that Triumph runs. The short answer is I don't know. As you all know, BWXT Medical is engaged in a method to produce more standard-looking Tech-99N generators using natural moly enriched in a reactor. So that's where my focus has been. So from a business point of view, my intention would be to provide a very robust, stable supply that would reduce the need for direct production Tech-99M. That said, I believe there could be some very interesting niche markets where this could be very appropriate. One thing I have heard on this is that sometimes there are challenges on the regulatory end. You can physically make the product, but because it's a path that the regulators aren't typically used to seeing, typically they want to elute from a generator, test it, you need to prove back to them that you're making good material. You can make very good material, direct production, to supply niche markets straight to these cyclotrons, but perhaps there are more burdens on, now I have to have a QA team that's bigger than I thought, because I need to get all the paperwork together and the correct testing, and there are a variety of pieces to this puzzle that are not as built out as deeply in the direct production market has been over the years for the generator market. I realize there was a lot of words in the air to not say a lot, but the reality is I think the answer can be yes in the appropriate market.
Well, that's great, and we have one last question before we wrap up, and actually maybe this is one I can help with coming from the power reactor side. It says, how do you use power reactors for medical radioisotope protection without causing disruptions in the power supply? And so the way I would look at this is that the amount of material that we're irradiating in a reactor is so minimal that it's actually really not even noticeable as an addition to the, let me characterize it as the neutron source. So think about it like in a research reactor. Let's say your neutron source is like a candle. In a power reactor, it's just for descriptor purposes, it's like having the sun, right? So you have a very, very large neutron source, and what you're doing in a power reactor for the purposes of electricity generation is through good, strong human performance in the plant, good, strong equipment reliability. You're driving very reliable electricity supply. And when you have reliable electricity supply, you have that neutron source available to you for isotope production. One thing I would say is, in the case of Bruce Power, is as we look to expand our production capability on multiple units, we have the ability to deal with this issue that our guests talked about, where you have research reactors that are out on outages. So if you take a look at the province of Ontario, at Bruce Power right now, we're providing probably about a quarter of Ontario's electricity, but we do have reactors out on planned outage. And so having that redundancy all on one site ensures that when you have one reactor out, either for a planned or an unplanned outage or an outage extension, that you have that redundancy in the other unit. And Mike, if I'm not mistaken, that's your plant at Darlington as well.
Yeah, you said it great. Just to reinforce that, obviously we do work with the fuel physics and the fuel management teams there to ensure that any targets we put in don't affect fuel performance or power performance. That's just key and critical, and that the device itself doesn't create a problem for the electricity generation. But as you pointed out, the materials that are being put in there are measured in grams or kilograms at most, to something in tons of fuel and megawatts of power. So it's the power reactor platform is just so powerful, and the upside to it is so immense that Ontario is going to be leading the way in so many things in the coming years that it's just so exciting.
Absolutely. Well, look, thanks very much, Mike and Andrea, for joining us, and I want to appreciate everybody for joining today's session. I thought we had a really good discussion on an important topic. Again, I want to thank the Canadian Nuclear Isotope Council for all the work and bringing this sector together and advancing this really exciting agenda. As you'll see, the Canadian Nuclear Isotope Council is very active on social media, so I'd encourage anybody who is here, whether it's on LinkedIn or Twitter, to join the Canadian Nuclear Isotope, follow us, share the information. And if you have any information on what your organization is doing in Canada's isotope sector, please share it with us so we can promote it. Again, I want to thank everybody for joining. You can visit the Canadian Nuclear Isotope Council website at isotopescanada.ca. Again, thank you to our guests for today and for everybody joining. Have a fantastic day.